This is Lemuka Chisali. Lemuka is HIV positive. She stays in the peri-urban community east of Lusaka called Kamanga.
Because our work is centered mostly around those women who are HIV positive, it made real sense that our objectives should also meet their real needs. And the first really was to improve the capacities of our community and the health workers to actually give out the prevention mother-to-child services.
I think it's very important, especially those who are not midwives, because midwives usually it's part of their curriculum, but all of us as we are working in the health centers, we come across these women who need these interventions. So it's important that everybody is embraced.
We managed to train about 40 nurses, health workers, so to say, from different clinics in Lusaka. And we also trained the 30 volunteers, community volunteers that we are working with in PMTCT. The community volunteers are doing a great job in such a way that they're able to follow up the people that are not coming for the programs.
The second objective would be around the ARV programs that enhance the mother-to-child transmission programs. The third objective was to enhance the woman's autonomy through small group activities where women are more aware of themselves and are more assertive in their situations. Then we have, of course, safe motherhood, which are centered around breastfeeding, education, and psychosocial counseling and related services. And the final objective, obviously, if we are doing all these things to the best of our ability, we hope to see a reduction. And so we hope to reduce the infant mortality rate as well as promote mother-to-child health.
One of the activities under this project is the food nutrition, where we supplement foodstuffs to people living with HIV and AIDS, in particular women within the reproductive age. And the project provides foodstuffs like 25 kg of milli meal, 300 grams of salt, sugar, cooking oil, carpenta, beans, and soya chunks. So far, we have a total of 300 women living with HIV benefiting from this program. And under the cooking demonstration, we usually invite 10 to 15 women every week to come and attend these sessions. And we have a facilitator from Kamanga Basic School who's facilitating the sessions.
Consistence ozwa olomopikira ndiyo sometimes uza gula veggie wabwera wajuwa ndiye posuka so anati kunzisa cha mukalibo juba mwasukirapo ndafya mkasuka ma vitamin ya Jones yasara mumanzi munja ndeva netinapunzira mopangira drink mopasira bana vakudya bane vingalete empamvu mutupimwao na vitamin.
The last component that the project has is the community garden. The project has established the community garden in Kamanga. This is at Kamanga Basic School. The project had gone into partnership with the school where land was given to the project.
Not only are the communities, the mothers benefiting in terms of nutrition, we have seen that the same mothers that are involved or engaged in the garden projects have children here. And we have seen a difference through our own program, which is called School Health and Nutrition, that we have had a positive response. We have had improvements in terms of, the nutrition levels of our children because of the gardens that we have under this project.
And so far we have about 80 women, vulnerable women, participating in the garden program. Another program we are running is a free health clinic, which is conducted twice a month. And we have 2 doctors working with us who go with us to Kamanga community to go and attend to the vulnerable community of Kamanga and Charleston.
We see a variety of patients in this clinic that range basically from kids, to elderly men. Obviously, we see more women than men, but most of the women that we have seen over the last few weeks also come with their babies who have different ailments, ranging from simple, upper respiratory tract infections, to complicated, diseases including cardiac, conditions. We also see patients who just walk in basically to have an HIV test done, which is a very sort of interesting arena. Finding. We have also had patients that have been with chronic issues, chronic problems, and have never sort of gained courage to visit a local hospital until we discover them here.
What happens is that when we have some special cases during the free health clinic, those people that need special medical attention are referred to other clinics, and these people are usually given transport money to facilitate for their movement from the community to the nearest clinic.
Our project has really benefited from some of the women that we support getting support in terms of skills training so that they can sustain themselves, empower themselves economically, learn how to take better care of their children, learn how to take better care of themselves, and this includes both women that are HIV positive and those that are HIV negative. And even the support that we've received in terms of the free clinics, doctors coming here on a bi-weekly basis and providing free medical checkups to all members of the community that need the service. So it's been an excellent service for our organization.
Another health education program we have is the drama performances. We usually have them once a month. They talk about different health issues. They talk about stigma, they talk about HIV, they talk about PMTCT. They sing, they dance and entertain the community in a way that the community would understand health issues. And they also encourage the community, especially the men, to be involved in PMTCT, because as far as I'm concerned, most men don't even know what PMTCT is. I've had, if not 5 or 10 men asking me what prevention of mother-to-child transmission of HIV is. And I'm happy to say that Charleston Clinic has come on board in such a way that they are providing the drama performance activity with condoms, because most men had actually requested for condoms during our last session.
As Charleston Health Center, we are doing very fine because the same project introduced a lot of activities. As the result, more especially in PMTCT, most of our babies who've been enrolled in this project are negative. And not only that, because this project is able to provide some food hampers, we are doing the food demonstrations. We don't have babies who are malnourished at the moment, because most of the times these mothers are equipped and are given skills on how to look after their babies.
It is a great achievement in a sense that some families whom I have personally visited to see before they started receiving these food hampers, their life has changed, because you can see how their children are looking like, how themselves are looking like, which means there is a good impact in the livelihood of the people in the community after receiving the food hamper. So if possible, I would have loved this to continue, both garden and the food hamper, including the mobile clinic, because it has helped a lot and people are happy. Because this is the first time, like on the mobile clinic, that they are seeing a doctor within the community.
International Development and Relief Foundation, in short IDRF, it's a Canadian-based international NGO, which is in the area of development work. This project, I can say that it's the first project that International Development and Relief Foundation is supporting in the country, and it's really helping the Ministry of Health a lot to realize the government vision on health, where the government wants to bring the health services as closer to the family as possible.
Importantly, I would love to say thank you to IDRF for giving us the opportunity, linking up with us in the Department of Pediatrics and Child Health, and working with us in order to ensure that Charleston Clinic and the Kamanga community have come together to work hard on trying to improve health. And so the willingness of our communities, together with the sacrificial love given by our nursing staff at Charleston Clinic, together with the money that IDRF has provided, I believe has made a really significant difference to the health of those target groups that we have mentioned.